Okay, which of the following is the most likely cause of this patient's symptoms? A 48-year-old woman comes to the emergency department with a 6-hour history of severe cramping, abdominal pain, nausea, and vomiting. She has a multiple history of prior abdominal surgeries, and physical examination reveals a distended abdomen, and her bowel sounds are high-pitched and tinkling. On palpation, there's a tender, irreducible mass in the right lower quadrant. Abdominal X-ray shows dilated loops of small bowel with air fluid levels. Which of the following is the most likely cause of this patient's symptoms? Okay, when I see someone who comes in with like multiple prior abdominal surgeries, that makes me think of um is it adhesions? I think it's adhesions
Okay.
or like things that like connect. And so that's to me the biggest thing here. To me it's not appendicitis, like it's not, I mean they said the right lower quadrant, and that's I think like a bait answer to get you to pick that.
Good.
Diverticulitis is usually in older people with bloody diarrhea, and I'm not gonna say this is what's happening at all. So
And
not that.
what quadrant usually is
The
diverticulitis?
left lower quadrant, it's the upside.
Good. Bingo.
And then gastroenteritis is more, I would say, acute issue. I guess it is an acute issue here as well, but it's not, in my opinion, going to relate to multiple prior abdominal surgeries. Like, I guess it could, but I don't think it's a risk factor for it. So I'm going to say not that. Volvulus could be an answer, but I'm going to assume because dilated loops of small bowel with air fluid levels, I'm leaning more towards adhesions related small bowel obstruction just because of multiple prior abdominal surgeries.
Final answer.
Yes, yes.
Good, great. I think you worked through that beautifully, right? Down to even breaking down all the other answer choices. So definitely for sure, right? You want to take everything in consideration. You got a 48-year-old woman, acute issue, right? Multiple, right? Obviously severe cramping, abdominal pain, nausea, vomiting. So you know it's an acute. And then they give you a history of multiple prior abdominal surgeries. If you overlook that, then you're gonna probably lead yourself to the wrong answer. But yeah, for sure, her abdomen is distended, right? She has an acute abdomen, and then irreducible mass in the right lower quadrant, right? And then multiple loops of small bowel with air fluid levels. So definitely for sure, you got a small bowel obstruction here due to adhesions likely from her prior surgeries. So that increases her risk. So it fits kind of your whole clinical picture here.